Hey, it's Melanie Petro. I'm in the process of making my office a total eclipse. Anyway, we've got some specials coming up, and I just wanted to tell y'all about them because we're really excited about. We watch the sky around here. So the total eclipse is, we're going to celebrate the, would you please come on this side? We're planning to celebrate the sky. I can't tell. Oh my, I love the sky. Anyway, the sun, we have several specials. If y'all have our emails, you got this. We have one about the sun, and that's a hydrofacial. If you haven't had a hydrofacial, it kind of looks like an aquarium, but it smooths your face, it takes away the dead skin, and then it infuses good things in there so that your skin looks really bright. There's no downtime. And dermaplane, it's $145, and that is the values in this email. So I'll post it in just a second. It says sun, moon, and stars. I love this email. The moon is micro needling. So y'all might have heard Chastity and I talk about micro needling. Have you seen it yet? Tish is in here.
I'm just writing.
Well, Tish, you have to. I'm not going to keep moving it and making everybody sick.
Well, if I get even closer, I'm going to be sitting in your lap.
Oh, well, that would be an interesting video. It's micro needling. Have you seen it yet?
No, actually, I haven't.
I haven't either. But we hear it's great. What I can tell you is I really didn't believe Chastity was going to be that great, but she really wanted it. And those of you that know Chastity know she's great. So I bought it because I trust her. And we've seen patients that I thought, I was really impressed. They come out real red, and I'm thinking, oh no. But it takes like 2 days, and your skin's better. It's good for texture. It's good for pigment. We've seen some great results.
Yep. I'm ready to
So
have it.
that's the moon package. It's going to be, if anybody's had it and will tell people, I'd love to hear it. I'm going to do it to myself soon. Micro needling, chemical peel. So that is $450. That's a good one because normally that's the cost of the micro needling. So you're basically getting a chemical peel, which you could follow up with, like a month later. And then like a light peel. You don't have to do these really heavy peels. You can do something like a pumpkin peel, which I think we're out of because I looked for it today to do. Scentsy peel. That's a good one. Then stars. This is mine. Stars is Fibella, Botox, and the brow lift. We've gotten a lot of questions about this since the emails went out. And the Botox brow lift and Fibella is basically, there's 2 ways to make an eyebrow look better. When people do this, nobody really looks good. When your brows can certainly get too high. So we're putting Fibella in the brow and then doing Botox basically to raise the eyebrow. So when you squeeze your brows and you weaken this muscle, it lets the medial brow come up. And then on the side, when you smile, if your brow comes down, a little bit of Botox there will let it come up. So that's the stars package. I love this. Fibella and Botox brow lift. That's $650. So that's basically, it's like $100 off. So
yeah, it's a good deal.
And people have been asking about units. I'll make sure I get your brows up. You don't have to worry about that. And so that's our package. We had an interesting day. I'm seeing a lot of lips. A lot of really over-injected lips to the point that this part of the face, it looks like this. And we saw at least 3. Then I saw somebody that had something in another country, and she has these big things that come down, and it's just filler gone bad. I don't do any permanent fillers. I know a lot of people do. A lot of people have had them. That's why I don't, because I like being able to get rid of it if I had to. When you start putting filler here, and this is not the only, this is at least the 3rd person I've seen like this in the past month. It's like you go to the doctor and you say, I want more, my lips not big enough, and they run out of room to put it here, so they just start putting it here.
Looks terrible.
It really looks bad. Not only that, they talk funny. So you can see your shadow under your talk. You can, I guess. But these muscles are fun. I compared it to a plaid shirt. Did you like that?
I was not sure where you were going with the plaid shirt.
Well, I was looking at a shirt I liked. It was plaid. It's a new trend, but
plaid?
I didn't get it because I can't see me with a pocket. Right? I don't think anybody looks with a pocket on their boob.
Like this?
Well, those pockets are high. It depends on how high the pocket is. Anyway, that's my take. And it was a plaid shirt. So I was thinking, really, that's how muscle fibers are. So when you start putting stuff, I have pads today. So pretend, okay, this is good. It's a good way to explain it.
You can put that
I
in
can't
your
use
lip
the
and
red
do it
one
straight.
This is kind of what it's like. So the muscle fibers are trying to contract, but there's all this stuff in the way. So they can't contract, and they have to contract for you to make a sound and to sound right. Only eat the red ones. Anyway, that's really what it's like. It's just blocking the contraction, so it's hot, honey. And it almost looks like a primate. Grant told me I look like a primate when I got braces. I didn't have them for long. But it was because I'm supposed to look that. So, you can definitely have too much filler.
Those are my favorite. These are my favorite.
Although I like those Charleston shoes. So we've got those specials coming up. We've got micro needling, which is really, really good. We're having great results from that. And we're seeing just all these lips. I like that people are sharing. I think we had at least one that had not had talk today, I think. You certainly don't have to share. But, you know, it helps people stay educated. And when people stay educated, you're less, nobody can fool you if you know. You know, knowledge is fun. Some knowledge. What else were we working on today?
All of the things coming up. Like,
basically lips. Botched lip fillers. That's huge. I almost have decided it's easier to mess up fillers. I know, Pamela, it doesn't look good. And it makes a shadow, so you can see it. I can see it. I can see a lot, though. It's about time to do our Botox. We did a lot of Voluma today in the cheeks, and we haven't done that in a while. I saw two people that I feel like are probably disappointed because once you get a puffy eye, you really can't do it. You can't add volume here. Like, I'm going to use my dots again. So, if it were red one, I'd eat it. So the fat, like there's fat that sits back in your orbit, and with time, it starts to puff out. And that's just genetic. And I remember telling my dad once, why does the fascia in the breast, like why is it so wimpy? You know, because it just lets your, and he said, well, maybe God doesn't want breasts to do what you think they should do. Maybe not. So the same is true with the eye. Because I said, why wouldn't you just make it stronger? And then we wouldn't have to go through this. So this is kind of, imagine that this is fascia and this is kind of holding the fat in. This is real weak, kind of like a spider's web. So with time, the fat starts to come out in these little globs. And then that's how you get that bag. And what's frustrating about it is you really can't just add filler around it depending on how big it is. And the treatment usually is at least a mini lift. God, that side looks better. It's time for some Voluma. And a little bit of a tweak in the lower eyelid. The lower eyelid's fragile, so when you're able to lift it up, then you can actually, it adds somewhat of support if you're going to have to take that fat out. So that's a surgical thing. The other thing that I think is really surgical is when you get jowls and your face is really square, you can do Voluma here. And it really helps. I mean, it helps lift and it helps the way your eye looks. But as far as putting filler down here, you'll just end up making your face look really square, like Herman Munster. Do you know who that is? That's what I was thinking today about Herman Munster.
Yeah, I used to go to school with a kid that we called Eddie Munster.
Hand was his person. Remember Hand?
No, that's not the Munsters. That's the Addams family.
Oh. Oops. Well, I was
Same
watching
era.
Bewitched.
Same
Bewitched
era.
is my favorite. So anyway, that's the deal, because you really can't put filler here. So when you see people that have had filler here, they're not happy. A lot of times around the mouth, if people aren't happy, sometimes they can't quite put their finger on it. And the reason is those little muscle fibers, the plaid shirt and the dots. So I see that. I will list the facials on, I'll list the facials on Facebook, the specials on Facebook. And then they're on our email. If y'all want to join our emails, I'll put that too. What's the number? You text PetroMD to
we'll find
5
it.
digits. So you just put in the 5 digits and you text.
It's like
yeah, we'll find it.
228 or
anyway, if y'all have any questions, always let us know. I hope everybody's having a good back to school week. And
on this rainy Tuesday.
I know it's been awful. I don't like the rain, but I love the sun. Well, thank y'all, and y'all let us know if you have any questions about any of that. And if you've had an experience and you want to share it, we would love for you to with lip filler, because, I mean, we'll just kind of stay on that for a while. And if you have too much and you feel like you're talking funny, then, you know, we're happy to help you no matter where you had it. So
you can always write a review.
Write a review.
Write a review.
Oh, yeah, you can write a review. About your filler. I thought she was...
About our show, no. Keep those to yourself.
Yeah. Anyway. The lighting, we're having an eclipse in here because I had to turn the lights out because Facebook didn't have filters. But anyway, I'm missing a lash person without Amy, and I really need my lashes. So if anybody knows anybody They can do a really good job with lash extensions. You can't even imagine what I would do for you. So, something good though. Something you would want. I promise. I really miss them.